Whether you're trying injectables for the first time or making a change to a new provider, the more you can learn about who your injector is before you're in the chair, the better that appointment will be. You're listening to Meet the Injector. Hello, and thank you for listening to Meet the Injector today. My name is Eva Shea, and my guest today is Amanda Rose, and she's an aesthetic injector at Allenby Cosmetic Dermatology in Delray Beach, Florida. Welcome, Amanda.
Hi, thanks so much for having me.
Now, Dr. Allenby's been on the podcast at least once. I'm trying to remember if I've talked to her more than once, but I've known her for a long time. And I think first thing I should say is how lucky are you that you get to
Oh,
work
yes. Oh my gosh,
with
she's
her?
brilliant. She's brilliant. Learn from the best.
How did you end up there? Tell us how you got there.
Oh man, it was one of those like meant to be circumstances, honestly. I was moving from Orlando down here to South Florida to live closer to my brother. And my realtor actually set me up with Bridget at the time, who was our operations manager. And they weren't quite ready for or in need of a nurse practitioner at the time, but kind of grew into a position for me, which was amazing. I previously worked pediatrics, so I worked with kids for 10 years prior to working and transitioning to the aesthetic side of services. And I was looking for a change of pace. I wanted to have my own family, and working with pediatrics scared the heck out of me because I did pediatric neurology last and it was pretty traumatizing. So I said, it's time to move to happy medicine.
Wow.
Yeah,
Well, yeah. I mean, I can imagine that um, that must have felt like a change that really needed to happen.
exactly. It definitely, if I wanted a family, I couldn't continue to see the things I was seeing. So,
I would love to know more about that, but that's not what this podcast is about. I just am
yeah.
so curious about everything.
Yes.
Um, what sparked your interest in injecting in particular?
So I've always dealt with skincare issues. I've had acne growing up. I have PCOS, polycystic ovarian syndrome. So I had a lot of cystic acne. So skincare was always top priority and interest for me. And it's the feel good medicine. So I wanted to work and help people feel better about themselves, especially in a state where, things with everybody's mental health was in a state of disarray per se. Everybody was kind of in that weird COVID era. So
Hmm.
that's when I decided that it's time to do happy medicine.
Do you remember what it was like when you actually met the team there?
Oh, yeah. It was totally different. I mean, you go from working in a hospital and, seeing all these sick patients to in an office where the clients are happy to come in and see you. They're not scared or nervous. Well, some of them are nervous, but you get through that. And just overall, the team, the doctors, the medical staff that I work with, everybody was so happy, so welcoming. It felt immediately like home.
And that they felt that way about you too. They said, "Come on."
Yeah, I think it was a
Yeah.
good fit. I really do. You have to have all different types of personalities in this field because people are attracted to, kind of their own avenue, who they can relate to. So I think it was a good fit.
Go a little bit further backwards and tell me what made you want to be a nurse in the first place.
Gosh, I wanted to be a nurse since I was probably 7 years old. It was young. It was really young, probably before I even knew what totally it entailed. None of my family worked medical or anything like that. It was kind of just one of those things that I decided I wanted to take care of people. I wanted to make a difference. You spend every day working for a living for the most part, and I wanted my work to be meaningful.
What is a day in the life like for you? Like, what time do you get there, and then what kinds of people do you see all day?
So usually I get here around anywhere between 8 to 9 o'clock, and I leave around 5 to 6 o'clock. I see various amounts of patients a day, on average anywhere from 7 to 12 patients a day. Um, and they will be booked for different cosmetic procedures, whether it's a laser or uh, microneedling device, oral therapy, or maybe Botox or fillers. Some of these patients are follow ups to follow their progression of things and see if anything needs to be tweaked. And then some are just new patient consultations, patients who have concerns who are coming in to try and address and find out what is it that they are looking for that could help them.
What kind of lasers do you have?
Oh my goodness. We have so many different devices here. That's why I love it. I mean, Dr. Allenby has been in practice for so long. That is one of the unique capabilities of our office here is we are able to customize patients' treatments, which allows us an advantage over some of the other offices, because we're not limited to one machine and one device. I have the CO2 cool peel laser. Which is an ablative laser. Resurfacing helps with brown spots, texture, and tightening. We have the chrome laser, which has an IPL handpiece. Again, helps with pigment, any vascular redness, browns, as well as a Fraxel. Um, to that same device has quite a different capabilities. It has tattoo removal, it has laser hair removal, and then it has the laser that works on the pigment and then the tightening. So, lasers per se, those are the two main lasers that we have. We do have another IPL laser handpiece on our Morpheus Optimus machine, as well as laser hair removal.
So, where do you keep all the machines? Are they all in, in one room?
Very good question. We have lots of storage space here. We do have a closet, and half the time they're in the patient's room. So we have one device per room, essentially, being used most times.
Mhm. I think there are special benefits to going to a cosmetic dermatology practice when it's a skin issue. How have you thought about that, and how do you talk to patients about what's great about being in a dermatology practice as opposed to just like a standalone med spa or even a plastic surgery office?
Right. Well, you have to understand what it is that you're treating, right? We're not just some of the offices that aren't focused on cosmetic dermatology in general or maybe a med spa. I I don't want to say anything bad. I mean, they each do great work. It's just sometimes they will focus on fixing a line or a wrinkle, whereas here we focus on the whole picture of things. So when I do an assessment for a patient, I'm not just going to talk to them about filling a line that they don't like or a wrinkle on their face. I'm going to talk to them about where it's coming from, how it got there, whether the bone and the fat pads shift around in the face, and then how to go about recreating and fixing that underlying problem rather than just sticking a band-aid on it. So I think it's important to understand, what's going on in the anatomy of everything rather than just a quick band-aid fix.
Being where you are there in South Florida, would you say that you're all experts at sun damage?
I would say yes. I'm not going to lie. I am guilty of enjoying time out in the sun. I fully wear my sunscreen, my wide brim hat, and even my face buff sometimes that my husband makes fun of me for, but
Wait, like a ski mask?
it's an SPF sun buff. So kind of, yeah.
You're calling it a buff. I
Yep.
feel like you're saying it's a ski mask. Like
I guess for those that are up north in the cold, you could relate it that way. Yeah. So he thinks I'm absolutely crazy, but I love going out fishing and paddleboarding. So I'm going to go and live that lifestyle, but I'm sure as heck going to protect my investment throughout.
Oh, yeah. On the water, especially where the
Yeah.
sun is reflecting off the water and you're out for half a day or a full day.
Exactly.
You
So,
need everything.
yeah, so
Mhm.
I'm crazy about it, but yes, we're constantly chasing that down here is sun damage. We have a lot of tennis, pickleball players, golfers, and then, your boaters, everything out like that out on the water. So that's a huge area.
What are your favorite sunscreens? Do you have
Uh,
what's in your purse? Give us the dirt.
I love tinted. So I like a tinted sunscreen because then I don't have to worry about putting on any cover up. I have melasma, so I like it evens out my skin tone without having to worry about anything. That's just one of my, things that bother me. So it helps build my confidence by being able to have a layer of that. But it's amazing. It's a Elastin Hydratint. So the Elastin sunscreen, and it's like glowy, dewy. It is perfect. I love it.
Everything gives me rosacea, so
Ugh.
I have one of those. I have that actually in my medicine cabinet right now, and I can't use it.
Oh, really? A good one for rosacea is Avene. If you haven't tried Avene,
Avene,
yeah,
that one?
yep,
Oh, I haven't heard about that brand in a while. Is that
yeah. They
a drugstore brand or is that something you carry there?
We carry it here. They do, I think, now sell it at Ulta too. But there's like an anti-rouge cleanser and stuff that does really good for my rosacea patients.
I will try it and report back to you.
Thanks. Mini consult.
Okay, so you guys are amazing at sun damage. Have you also seen people with skin changes related to weight loss since so many people are losing lots of weight?
Definitely. And this is a big subject here because we do offer the weight loss injectables. So, and I actually streamline that program here. So I manage all of our weight loss patients. So we do a lot of this in the preparation of putting them on these injectable medications because everybody wants to get rid of fat, right? Nobody likes fat, but fat is a great thing when it's in the face. Why? Because it helps to hold up tissue. So when you lose fat in the face, you really start to see some of the signs of aging, okay? Especially anybody 50 and older specifically, which we have a lot of that clientele here. So, and the thinner you are, the more that you see because you start to see those bony skeletal changes. And like I was saying earlier, kind of back to how shaping is what ages us, you start to notice those underlying shapes that age a person more so when you lose that underlying fat. Think about when you're young, baby, kids, they have tons of fat in their face. You just want to squeeze them, hug and kiss all over them. So as you age, when you lose that fat, it does age you a little bit more. So we offer those, complementary. They are complementary therapies in the sense
They're
that,
not
yeah,
free.
they're not not in that way, but they complement the weight loss injections because they can restore volume replenishment. So where you're losing that bone and your bone's remodeling, you're losing that fat, you can replenish with volume using hyaluronic acid fillers or Sculptra, like to stimulate your own collagen.
Do you do sculpture yourself?
Yes, I love it. Sculpture is
Yeah.
one of my most favorites for sure. I feel like it's a very natural way to revolumize without that overdone or puffy look that's, some people get scared off of with fillers. Of course, fillers shouldn't naturally be that way. I think they get a bad reputation for being overdone, especially down here in South Florida. But when they're done correctly and in the right place, you can look totally yourself, just more refreshed and a little less tired.
Have you heard of Mar-a-Lago face?
No, I haven't. What is that?
That it's it's a specific kind of filler face
Oh,
that everyone who goes to apparently,
I
according to the Daily Mail.
oh, okay. Yeah, I haven't heard that one yet. There's all different things out there for it. Pillow face, that's what we hear a
Mhm.
lot, so bunch of different terms running out there.
I sort of wondered recently, did this overfilling come from the size of the syringe or the size of the vial and a need to try to use it up? Like, is that plausible,
I
or am I
don't
just imagining
I don't
things?
think so. Honestly, I think it's people placing it in the wrong spot. Like I said,
Ah,
the people who are chasing lines and say, "Oh, I don't like this line here," and they place filler in the nasolabial fold, and then it ends up here in your fat pad, and they end up puffy and weird looking, and they're like, "What happened?" Well, you put filler in the wrong spot, or they're using the wrong product. Some are more stretchy, some are more firm, meant for different areas of the face. So I mean, one syringe you have to remember is the size of a blueberry. So when you're trying to lift and revolumize, like one syringe being the size of a blueberry, like you're not going to overdo it with one syringe. No way. I mean, I put one syringe in a 20-year-old. I myself in my 30s do 3 to 4, just to give you a gauge. It's very, very little.
mhm. And you don't look like you have any.
Thank you. I haven't in a very long time because I've been breastfeeding. I had a baby, so we're going through that. We're due for a mommy makeover very soon.
Yes. The most annoying thing about being pregnant is that you can't get Botox and filler.
Literally, I'm like, my lines are so etched. I can't wait. I'm sure everybody in this office wants to poke me with a needle.
Patients are like, "Are you sure?"
Yeah, exactly. I'm like, don't judge off of me right now. I'm like,
When you started doing the weight loss program, did you almost immediately start trying to prevent that sort of facial aging from accelerating? Was that in parallel for
yes.
you?
Yeah, I'm pretty blunt. I'm upfront, so I like to be honest with my patients and say, you're going to love these in the sense of like there's lots of studies that show that it improves your cardiovascular health, your kidney health, your overall cholesterol and things of that sort, as well as losing the fat. But you may end up with stubborn fat pockets in certain areas that we can help get rid of with cool sculpting. And you're also going to start notice, okay, I see things in my face maybe I don't like or didn't notice as much with this weight loss. So I do have that open discussion in my initial consultations and then tell them when we get to that point, we offer these services, or if you want to get ahead of it, we can do this, this, and that.
Do most people want to be ahead of it?
Yes and no. Honestly, it depends on cost and what they have budget wise. Yeah. Yeah.
Do you guys have financing or payment plans that you help people with?
Yep, we do. We do. We always have specials that we run, and we do have financing through Cherry. So we have different programs that can help with financial assistance.
What do you do outside the office except other than have your baby?
We're very social people. I mean, we like to fish. I like to paddleboard. Like I said, guilty about enjoying the sun, but with my protective sun measures. Um, and really just going to a nice dinner, hanging out with the family.
I hear there's great food where you are.
Yeah, amazing. I mean, my husband dives a lot, so we get fresh seafood, and so half the time I'll even just cook it at home. So, yeah, I can't
That's a
complain.
really useful hobby.
Yeah, right? I'm like, "Okay, you can go diving, sure. Just come home with something."
That's great. Where should we follow you online, or find out more about you if we're interested in coming to see you?
Of course. So, best way would be to follow me on my Instagram page. It's Injections by a Rose. And you'll have all my information for the office. You can actually click, there's a link in my bio if you want to make an appointment to have a consultation with me. I'd love to meet you. I mean, like I said, I'm a pretty forward person, but I'm honest and, pretty open. I would love to help any and anyone who's interested.
Thank you, Amanda.
Of
It was
course.
great getting to know you today.
There's no substitute for an in-person appointment, but we hope this comes close. If you're considering an appointment with this provider, be sure you let them know you heard them on the Meet the Injector podcast. Check the show notes for links, including the Injector's website and Instagram to learn more. Are you an aesthetic injector or do you know one? You can be a guest on Meet the Injector. Book your free recording session at meettheinjector.com. Meet the Injector is made with love in Austin, Texas, and is a production of The Axis, TheAxis.io.